Hello, and thank you for joining us. My name is Sue Spalding, and I am the CEO of the Alzheimer's Association Minnesota North Dakota chapter. Welcome to our state Alzheimer's Rally Kickoff. Thank you for all the legislation you have helped pass. As you know, the Alzheimer's Association's vision is a world without Alzheimer's, and together you are helping us get there. If you have shared your story with elected officials over the years, you have been essential in advancing our public policy priorities in Washington, D.C. and here in Minnesota. And if you are new to Alzheimer's advocacy, we welcome you and we are honored to have you tell your story. Let's take a moment to celebrate our incredible legislative victories over the last decade. The passage of the National Alzheimer's Project Act in 2011 fundamentally changed the way the nation addresses Alzheimer's. That victory paved the way for critical research, care, and support policies. With bipartisan support in Congress, today federal Alzheimer's research funding is $3.1 billion annually, a more than seven-fold increase in the last decade. That is amazing. And our efforts in Congress have meant Medicare now covers comprehensive care planning services for people living with dementia and their caregivers. In Minnesota, we have seen great successes. In 2009, the Alzheimer's Association was the driving force behind legislation creating the Alzheimer's Disease Working Group. And in subsequent years, we worked with bipartisan authors in the Minnesota House and Senate to pass Alzheimer's research funding that stays right here in our great state. And with partners at the Minnesota Board on Aging, we developed and passed legislation creating the Dementia Grant Program, which funds local community efforts around the state to increase awareness of Alzheimer's disease, to increase the rate of testing, and to connect people to resources and support. After 3 vigilant years of work with partners at the Minnesota Department of Health and our community and professional organizations, we were instrumental in the passage of the Assisted Living License Bill. The Alzheimer's Association led the effort to ensure dementia training and quality care policies were included in the landmark legislation. Soon you will hear more about a partnership we envision with the Minnesota Department of Health once again. And last year, while our state was rocked by the pandemic, with your support, we were still able to pass legislation that improved a caregiver respite program to help support family caregivers. Legislation that helps caregivers is vital. Despite all of these incredible achievements, Alzheimer's disease remains one of the most critical public health issues in America and here in Minnesota. There are more than 5 million Americans living with Alzheimer's disease, including nearly 100,000 people in Minnesota. And this number is expected to increase by 20,000 more people in just 4 years. Alzheimer's disease has been called the most under-recognized public health crisis of our time. Every 65 seconds, someone in the US develops the disease. But behind these numbers are people like you and people like me. This year, with our legislative ask in Minnesota, we have a real opportunity to shed more light on the importance for early detection of Alzheimer's, the need for all communities across our state to understand dementia more clearly, and how Minnesotans can speak with their doctors about their cognitive concerns. Thank you once again for all that you do on behalf of those who are impacted by dementia and Alzheimer's disease. Now I'd like to introduce Molly O'Brien, our Chief Strategy Officer, and Sherry Sanchez-Tibbetts, Director of Diversity, Equity, and Inclusion. Molly, take it away.
Thank you, Sue. These are critical times for those of us working in Alzheimer's care, support, advocacy, and research. And what's alarming are the rates in which dementia and Alzheimer's touches some communities harder than others. Current research shows that women, Blacks, Hispanic and Latino Americans, Native Americans, Alaskan Natives, and LGBTQ members of our community are disproportionately impacted by Alzheimer's and other forms of dementia. This means they are more likely to get the disease, more likely to be diagnosed at a later stage, and less likely to receive the care and support they need. For example, research shows that nearly 2/3 of Americans with Alzheimer's are women, and Blacks are twice as likely, and Hispanic Latino Americans are 1.5 times as likely to have Alzheimer's or other forms of dementia.
Today, the Alzheimer's Association releases its annual Facts and Figures report with a special section on racial and ethnic differences towards Alzheimer's and dementia. In this report, Indigenous people and communities of color speak of the discrimination they feel in access to quality healthcare and involvement in Alzheimer's research. It's important that we understand that the health disparities that Molly shared aren't caused by genetics alone. 2020 has shown us that some communities are at a greater risk to experience housing instability, food insecurity, and a lack of access to quality education, healthcare, and economic opportunity. Indigenous people, communities of color, and LGBTQ people may also face a lack of social connectedness and social support. Our communities are more likely to have health conditions such as cardiovascular disease and diabetes, which are associated with an increased risk for Alzheimer's and other dementias. We are also likely to experience a high level of exposure to adversity and discrimination. Systematic inequities can cause health disparities. In other words, not everyone has a fair and just opportunity to be as healthy as possible. Sometimes a policy, a practice, or a system can benefit one population while disadvantaging another. At the Alzheimer's Association, we're deeply committed to addressing such inequities.
You're absolutely right, Sherry. And while we've made a ton of progress, we have such a long way to go to serve the communities who need us most. Advancing diversity, equity, and inclusion is vital to our mission, and our entire organization is focused on doing that. We want to engage all Minnesotans to share our resources and support to those who are impacted by the Alzheimer's crisis. Together, by working with community organizations, faith groups, community health clinics, and larger healthcare systems, we can create the systemic changes needed. To have a meaningful impact, we must first create awareness of Alzheimer's and dementia and address the need for early detection in healthcare settings. That is why I'm really excited about this year's policy priority that Beth McMullen will speak to you about in just a moment. It has such potential to make a real difference in Minnesota and to help us carry out our commitment to serve all communities impacted by Alzheimer's. Finally, thank you, advocates, for championing our cause, sharing your stories, and shaping the future of legislation for Alzheimer's. Now, I would like to introduce Beth McMullen, our VP of Government Affairs.
Thank you, Molly. Well, we can't be together in person at the Capitol like we normally would be for Rally Day. We can still make our voices heard by lawmakers. And we certainly showed that's possible over the last year with the successes we had in St. Paul and in Washington, D.C. Thank you so much for taking the time over this week, joining your fellow Minnesotans for this Alzheimer's advocacy series. Over the course of the next few days, we want to prepare you with information, training, and an opportunity to help us advance this year's policy priority at the Minnesota Capitol. As you've just heard, the burden of Alzheimer's and dementia is large, nearly 100,000 Minnesotans living with the disease. The impact is major, going beyond the individual, affecting a person's relationships, their communities, their well-being, and the way we deliver care. But there are ways to intervene. As our organization strives to develop a cure through research around the world, we continue to improve the quality of life for those living with the disease and to decrease associated costs. We know that early detection and diagnosis of dementia and Alzheimer's means individuals receive better medical care and health outcomes. They can plan for future needs, secure medical desires, and make their wishes known. However, research suggests that a large number of people living with Alzheimer's are not properly diagnosed, and many are unaware of their diagnosis. That is why this legislation we're proposing this year is so important. This year, our policy priority is focused on legislation that can have an impact with Minnesotans who may not know much about dementia or Alzheimer's, or who might be afraid to talk with their doctor about their own cognitive health concerns. Our legislative champions, Senator Carla Nelson and Representative Fu Lee, have introduced a bill that will call on the Minnesota Department of Health to create a public awareness campaign with culturally specific messages about what dementia is, the importance of early detection and diagnosis, and how to talk with a healthcare provider about it. I am very excited about what this legislation can do. With this bill, we can improve our neighbors' understanding of this disease. We can reduce the frustration of people who might otherwise struggle trying to comprehend what's happening to their family member or friend. And we can help someone figure out how to raise a concern about their own health with their doctor. We can change lives together. So, how are we going to prepare you to help with this important work? This week, we've got a lot to share with you. Tomorrow, we'll be hosting a live issue briefing with our State Affairs Manager, Josh Nye. Josh will provide you with more background on this public awareness campaign legislation. You'll have an opportunity to ask questions during that live event. We want to make sure that you feel equipped and comfortable about talking about this initiative. We'll record it, so if you can't make it live, you can always watch it later. On Thursday, we will release a podcast with Senator Nelson, who'll speak about why she thinks this campaign is important for Minnesota and a little about her own journey as a caregiver. On Friday, we'll host a live event on the ways you can share your story with a legislator. We'll share tips and tricks about linking your personal experience with dementia to our policy priority, all with the goal of convincing your legislator to support the bill. Then next week, we'll be hosting Live with Legislators, which is your opportunity to hear from our chief legislative sponsors of the Dementia Public Awareness Bill. These champions will tell us why this bill is important and personal to them, how the bill is advancing through the legislative process, and how you can help by sharing your story with your legislators. Along the way, we'll provide you with ways to communicate with your state Senate and House members, asking for their support. As Sue said earlier, it is because of dedicated volunteer advocates like you that we have made a difference at the Capitals in Washington, D.C., and right here in St. Paul. As we conclude this kickoff, I want to address the historically tough year that we've had. The COVID pandemic has created difficulties for our country, our state, our economy, and us as individuals. And people who live and work in long-term care settings have been hit particularly hard. Our elected officials are trying to make good decisions, and they're going to be faced with competing priorities as they continue to respond to the pandemic. We need to make sure that Alzheimer's is at the top of the agenda. Despite the challenges that we faced during the pandemic over the last year, together, we have made a difference for those living with dementia and their caregivers. Let's continue to raise our voices, continue our advocacy work. So I want you to keep your eye out in your email inbox for messages from me with links to the upcoming events, recordings, and ways for you to take action and to make your voice heard. Thank you so much for all that you do. Let's have a great week.